start with the patient goes into you. Take me through the process. I mean, how do you look at the face? What seems to age first?
Well, there's two types of aging. There's the chronological age, which is the number that you put on the age, and there's the physiologic age, and that's the miles on the odometer. And the most useful technique that we have in our office is a computer, an imaging computer. And what we do is we take a photograph of the person, and we basically look at the photograph from different angles, and we show it to the patient. And we talk about what changes they want to make and what things they don't like about themselves. And then we're able to morph that photograph and actually do the changes on the picture.
Is that pretty accurate?
It really is accurate. You know, we don't overdo it. We don't oversell it. We use it as an index of what can be done. There's no guarantee or no warranty associated with it, but in general, I do better than the image machine does.
So what subtle changes make the biggest? Let's start with the eyes. What are you doing for the eyes?
Well, I think the most important thing about the eyes is most patients who come in and want their eyes done really traditionally need a brow lift. Let me show you a couple of photos I brought today, Randy, and I'll show you what I'm talking about. This is a good example of the youngest patient that we see in cosmetic surgery. This is a young girl that was brought in by her mom because she had protruding ears. And usually what happens around 6 or 7 years of age, these little girls or little boys get teased by their peers. This girl was having a lot of trouble in school. She was being teased by her peers. She was doing poorly in her grades. And she brought her in to have her ears pinned. And this is about the age that we do this.
That's an easy procedure.
It's a relatively easy procedure, and it changes this little girl tremendously. This little girl is now a straight A student. She's very popular. And I mean, would she have been that way anyway? Well, maybe so, but this really helped her.
Let's take a look at a few more.
Let me show you a really good example of what I'm talking about when I talk about endoscopic surgery and I talk about brow lift operations.
Okay.
This young lady comes in, she's about 45 years old, and people tell her she looks tired, she looks sad, she looks angry. And her eyes are kind of baggy, and she just doesn't feel good about herself. This is what we call a scarless facelift. By making tiny incisions in this patient's forehead and doing a little surgery around the eyes, we can rejuvenate this person and make them look much younger, much better. And the operation has minimal downtime.
Now, when I look at the before and after, she had bags.
Right. Well, we take the fat out. We take the fat out from around the eyes, from the inside of the eye, without an external incision, and we lift the brow and reposition the cheekbones, and that's the key to it.
So this woman, brow lift,
lower lid blepharoplasty,
okay,
and mid-face suspension.
What about her neck? She had a good neck to begin with.
She has a good neck. She's young enough to where she doesn't need a facelift.
And that's a big difference.
Big, big difference. And this is an operation that doesn't need to be repeated. Let me show you another example of what I'm talking about. This is a young lady that comes into me, doesn't feel very good about herself. Okay, now take a look at this before picture, Randy. This young lady comes into me. She's about 42 years old. She just had a baby. She's lost a lot of weight after her baby. She doesn't feel good about herself. Her friends tell her, look, she looks tired, she looks angry, she doesn't look happy. And
got kind of a tough face.
Tough face. And the reason why is she's lost a lot of fat in her face, her brows have fallen down, her nose is too prominent. So what I did with her is I lifted her brows, I did her eyes, I put some fat back in her face.
When you said did her eyes, what did you do?
Well, I did an upper lid blepharoplasty.
Now, when you say blepharoplasty, what are we talking about?
Well, I mean, take a look at her eyes, Randy. Look at her brows. Her brows are really low. Her eyes are a little bit sallow, and she looks sad.
So the heavy skin over her eyes is...
Well, that's extra fat, extra skin, and extra muscle.
Okay.
So what we do is we elevate the brow first and reposition the brow, and then we take out any redundant skin that's above the eyelids, and we take out the fat from below the eyelids. And the elevation of the cheek and repositioning of the fat into the face and a rhinoplasty altogether make the big difference in this patient.